Hello, everyone, and welcome back to our Facebook Live, Instagram Live Fertility Q&A. I'm here with Dr. Ellen Wood, and we are very excited to bring this to you on Facebook and Instagram again this week. So I would like to encourage you to type in your questions and make sure that we'll get to them. We are excited to be here again in our, ninth session probably.
Yeah, I just went live.
So, I'm going to join Dr. Wood now on Instagram. So I will go ahead and go into our Instagram.
So hi, my name is Dr. Ellen Wood. I am one of the reproductive endocrinology physicians at IVFMD.
So we're requested to be in Instagram now, and
I am currently we're going to do a joint Q&A with Dr. Duro, who is an acupuncturist in the area. So hey, how are you guys? So let me just answer her request so she can join us in the live feed on Instagram. So we're on Instagram tonight, and we are also on Facebook. Hopefully this is going to technologically, there she is, awesome. So hopefully technologically this is going to go well tonight. So far so good. And so we have received a whole bunch of questions beforehand. So I think we should just kind of start with those. And thank you, Cooper City Office Rocks. So let's start with some of those questions. And again, some that we recently got today do involve acupuncture. So I'm going to let Dr. Duro introduce herself on Instagram as well. Let's start with, again, some of these acupuncture questions, because I think they're pretty cool and interesting.
Yeah, I'm excited to be here. We might need to turn the volume down, though, a little bit on your computer. But yes, that's good. Oh, good. So, yay, I'm not echoing anymore. Okay. So I have a practice. Oh, I do hear myself still. Okay, a little bit. Okay, yeah, okay. I have a practice in Southwest Ranches, and we near Weston, and we've worked with fertility patients since 2004. And especially Dr. Wood's practice as well at IVFMD. We love all the doctors and the nurses there. They're awesome, and we're excited to be here to really offer an integrative approach and to answer all your questions tonight that you have.
All right, so we have a couple that I've gotten on Instagram to start with. And so one of them is, does fertility acupuncture need to be a certain length of time?
There is recent studies that have shown 12 or more sessions are most beneficial. So if you do have enough time to do 12 sessions before the start of your medicated cycle, that would be great. Some people don't. Some people don't really know about acupuncture until they're almost ready to have their transfer. So we will also work with them. But I think it's optimal if we can try to get 2 treatments in a week at least during the, let's say, the 6 weeks leading up to the cycle. Yes.
Yes, and I agree. I mean, I think a minimum of once a week, if you have the time, twice a week, in order to improve things, but definitely for several weeks, 4 to 6 weeks, sometimes 8 weeks before you're doing your transfer, I think really would optimize, blood flow. And then we've got another question about acupuncture. So interesting question. So, you can enlighten, I mean, I have kind of a little bit of idea being an osteopath and these little pressure points that we were taught, in osteopathic medicine class. But where should the acupuncture needles be placed? I think that's we've seen these diagrams of just these nerves that just anytime I've gone into an acupuncture office, it's just like nerves everywhere. So I know that's what they teach. That's what they teach you guys. Where exactly to put the needle. So exactly what kind of things. I saw that cool picture that you posted today and somebody having an acupuncture session. It's like,
yeah, it was just now. Yes.
That was pretty neat.
And thanks to our patient for volunteering for a picture. But I think the main thing is what are you trying to address and where are you in your cycle? And there's a lot of factors going into selecting the points, since there's about 370 points in the human body. So we need to learn, which ones are, we use extraordinary vessel points in our practice. So every acupuncturist has their own strategy, but there are some points that really overlap and go through the ovaries, the uterus, the breast. And those are the ones that we focus on the most. And sometimes there are in the abdomen if we're looking at electroacupuncture to help provide more blood flow to help those medications get to where they need to go and help the treatment that you're doing work better. And then we're also going to look at back points. I find a lot of patients have lower back pain in the same points that correspond to fertility issues. So looking at the sacrum, the coccyx, and all the innervations that go through there that actually connect to the uterus and all those vital organs there, it's really important to address the pelvis. So I kind of do a combination approach where I do a little I was trained with osteopaths in school. Actually, my instructors were osteopaths, so I love osteopathy. And really, they taught us how it's important to pay attention to the mechanics of the body, and also, I integrate that with the acupuncture. So, that's kind of my long answer to that question. But definitely, if you're looking at that, what are you trying to achieve? That's important in selecting the points that you need.
Yeah, no, I was just actually reading I was reading a book with I was about one of the characters in the book. They had she was addicted to pain pills because she had some sort of chronic hand pain and blah blah blah. And she met this person in the book, blah blah blah, and they recommended an acupuncturist, and basically they weaned her off her narcotics because it was just like just an outward way of thinking, and the person who had recommended this to her was kind of like, everybody thinks they should just treat it with a drug, like, here, take this pill and it's better. So it's very interesting that there's so much involved in the body healing itself, and again, that's what osteopathy is about. It's just if you fix the body and put it back in alignment, and you put it back the way the blood flow should go, and you put it back the way it should be, the body will fix itself. So I've seen it work with polycystic ovary patients. I've seen it work with diminished ovarian reserve. Like, just really just we see the body's broken, and I'm trained in just traditional medicine. So again, we give you drugs to try and fix it, but there's so much more involved in just putting that body back in alignment. And again, that question that just came across is, how does acupuncture help fertility? And again, fertility, unfortunately, infertility itself is a disease. I mean, there's something just not right going on with the body. And so there's many different approaches as to how to fix the body. And so we like to incorporate all different types of treatment, whether it's just, you need a medicine, and many times medicine work, but if you use that medicine in conjunction with improving body wellness, which is part of acupuncture, and blood flow and realignment, and there's so much involved, it really helps fix the disease. As opposed to just, here, have some pills or have some shots, and, which works too. But it's a better approach is to look at the complete body wellness approach. And that's what I've always kind of philosophized as far as practice, because that's what I was taught as I was trained, 25 years ago. So
definitely. We're not two-dimensional textbooks. Everybody is different, and I think anxiety is really one thing that we come across quite a bit when someone is concerned. Is the treatment going to work? How many months am I going to have to try? And am I going to have the energy and the actual mental fortitude to go through another cycle? So I think acupuncture has been proven to help with that as well. And that's across 6 or 7 studies that I've looked at recently. That's important because that's resilience. And something about this treatment kind of helps stress fall off a little easier. So you're like, okay, it's still there. It's not going to make stress go away, but I can react to it differently. And I don't have to, respond in a way that I'm being chased, like by a bear. So.
Right. And again, and they've, years and years ago, I mean, these studies have been done multiple times looking at cortisol levels. And, cortisol is your stress hormone. And anytime the body's under stress, you can measure, cortisol levels in the body. I mean, I don't know whether, I know different physicians who do saliva cortisol levels, and they've been done in IVF studies. And the higher the saliva cortisol level is in, a patient who's undergoing IVF, actually, the lower the pregnancy success rate. And so there was clearly a correlation between stress, whether it's perceived stress, okay, and the body will sense a lot of things. And so you say, oh, no, I'm good with this, we're good with this. But there's something underlying on the surface sometimes that your body is not, your brain may try to tell yourself you're good with it, but you're actually under, you know, in the subconscious, you're not. And so that's where those elevated cortisol levels can come in. And to try and lower that stress, I mean, in whatever means that you have, and, you know, that, how long are your sessions, Dr. Duro?
Usually they're about 45 minutes. Yeah.
Right. And again, when's the ideal time for patients to do them? Is it usually like kind of after work, or when do you, I mean, I know during the day, but a lot of people work, so.
Right. We're open 6 days a week. So that's one thing that we're really committed to. There's 2 practitioners. There's 2 of us. Dr. Aracina is fabulous, and she is here every single Sunday. And then I'm here. Yes, we're committed. And we're on Saturdays. So people love the fact that they can come in on a weekend, and also they can come in after work as well. So I think it's, you know, we're here till 7, usually 7:30. So it's the only day we're not here is Monday, but we try to work with people's schedules because we don't want to give you more stress trying to get to our appointments, you know, and we're trying to alleviate it. So that's usually what we do. And then we try to arrange for you to have acupuncture with IVFMD is also very good about telling their patients about acupuncture availability during the transfer itself.
Right. Yeah. So we'll have acupuncturists, Dr. Duro. We work with multiple acupuncturists in the area, and what they'll do is they'll come in, they'll administer the acupuncture prior to doing the embryo transfer. Because again, this is a time where we want you chill, we want you relax. You know, we don't want your adrenaline surging. We don't want you scared of the transfer. The transfer an embryo, you know, should not hurt. It should not be a difficult, stressful procedure. This should be something that you should be like, oh, the embryo's in. Like, how did that happen so quickly? Like, I didn't feel a thing. I mean, that's what we want. And then again, we want to improve that blood flow. You know, prior to transfer, we want to alleviate uterine contractions during the transfer, and again, then after the transfer, I know you do your thing. I put the embryo in, and you do your thing before and after. So
we usually recommend still continuing the treatment twice a week till the ultrasound shows a heartbeat, and then once a week during the first trimester. And we start with the early nausea prevention points right away, even before you know you're pregnant. Like, we're trying to do those channels that are helpful for nausea. So a lot of times the patients don't really feel a lot of symptoms, and they're like, what, am I pregnant? I have no symptoms. I don't understand, you know, and it's not a bad thing if you don't have symptoms. So
yeah, no, those, again, I must say something about those acupuncture pressure points. Okay. I've been on helicopter rides where those pressure points have kept me from puking. I mean, it was just like, you know, and I'm like, push it, push it. No, I do not want to throw up in this helicopter. That would be really gross. Just a little rocky.
2 finger width here.
Again, it worked. Trust me, I did not throw up in the helicopter. So I am a major believer in acupuncture pressure points. Which is very tenuous helicopter.
You had an indentation when you got off the helicopter.
Oh yeah. But literally, nobody smelled, or I did the bag. No, I made it on the ground. I made it to the ground. But
that's awesome.
After the helicopter ride, I'm telling you, acupuncture works. Pressure points, they are the bomb. So again, if you start that early, it can really alleviate that pregnancy, the pregnancy nausea. I mean, nothing takes it away. But it really does take the edge off, and can make, you know, your life bearable as you get through that first trimester. So I'm a major fan. I have another question here. Would you recommend increase of acupuncture working up to transfer, more than 2 a week? I've always done 2 a week. I mean, that's the most I've ever kind of done. So
yeah, some patient, we've done it a few times where it's been 3 times a week if they're stimulating and they're not responding very well. And we try to work like, 3 times a week during stimulation, but usually it's usually twice a week typically. Yeah.
Okay. All right. We got another question, and Alexa oh my gosh, you just got engaged. Oh, congratulations.
Congrats.
Congratulations. That's awesome. And again, she has endometriosis. She's taking the Orlisa, which is an amazing drug. I want to have a child by next year after my wedding. What do I do to prepare my body? When do I stop Orlisa? So you do not stop Orlisa until you are, ready to try. Okay. Because currently the Orlisa is keeping you from ovulating. So minimum of 2 to 3 months. Okay. my personal opinion is to prepare your body, because your eggs are what happens 2 to 3 months. When you're going to start to ovulate again, those eggs are going to be a product of, what went into your body, what your body experienced for 2 to 3 months prior. So you want to start with first thing, easy. And sometimes, again, we're, subspecialists, we do high-tech medicine, and sometimes we forget for simple things. But folic acid, prenatal vitamins, the most absorbable form is quatrefolate. And so to have that on board for 2 to 3 months prior to conceiving. Other things, I think you've been working with one of our fertility doctors, so make sure that your genetic screens are done. Make sure that your hormone values are good. Make sure your thyroid is optimized. Make sure your vitamin D level, which is just incredibly critical. Like it's amazing. I just have an article that just came out a couple of weeks ago that basically, to optimize vitamin D, improves implantation. They did this double-blinded trial somewhere or other. I have it on my phone, but basically optimized vitamin D in one group. The other group had suboptimal vitamin D levels, and there was actually a significant difference in implantation rate. I'm thinking, wow.
That's really important.
It was super impressive.
Yeah.
So, again, so if you're on a drug that's suppressing ovulation, and again, you might have problems getting pregnant because you're not sure. I mean, not everybody with endometriosis has problems getting pregnant. But if you might have problems getting pregnant, you want to, go into that, try getting pregnant with, optimized iron levels, optimized vitamin D levels, optimized folate levels. Make sure that you don't carry any genetic diseases that your baby could be potentially affected with. It's just, again, it's preconception counseling. And I'm sure, I believe this, Alexa's working with a fertility specialist in one of our practices. And again, that's what we do as fertility specialists. We do preconception counseling. We try to make everything like optimized and say, because I'll have patients who come to me who have polycystic ovaries and say, hey, I want to get pregnant. What do I do? I'm like, stop the birth control pill.
Yeah, for sure.
But before, because again, birth control pills are the mainstay. That is our primary treatment for patients with polycystic ovaries who do not want to conceive. So if you have polycystic ovaries and you want to conceive, before you stop that birth control pill, let's do your preconception testing. Let's optimize your health. Let's optimize your weight. Then stop the birth control pill. And you might not even need my help. When we've done that, I've had patients say, when do I call you? And I said, well, if you've been off the pill for 6 weeks and you haven't gotten a period, I've had patients pregnant. Like they stop the pill, they ovulate 2 weeks later and they're pregnant. So, they may not have a problem. So an endometriosis patient who's on the Orilisa might not even have a problem. The Orilisa may have burned out the disease and presto, you're pregnant. You also probably would want to check your fallopian tubes if they haven't been checked, while you're on the drug, to make sure that there's no, adhesion to scar tissue or blockage. I mean, all of this is just preconception. So once you get off the drug, for the fear of that you're going to have your pain back, because the drug is obviously keeping your disease in check. So you don't want to stop the drug too soon and then, start having pain and have the disease grow back and things like that. So to optimize everything while you're on the drug, again, 2 to 3 months before is perfect. I mean, it gives us that opportunity. And again, congratulations on your engagement. That's so awesome.
They're asking about an acupuncturist in Naples. And I don't know, but I think if you go on aborum.org, I can type it in the chat.
You mentioned this last week.
Yeah.
And again,
we'll do that. Yeah.
Yeah, because I know there's fertility acupunctures.
There has to be,
yeah. But I mean, I have such a huge network, here. I mean, we have Miami, and then we go all the way up to Jupiter, with our network. Oh, okay. She wouldn't think vitamin D was important. No, honestly, vitamin D, I swear, is like kind of this sleeper, like magic drug. And it really is. I mean, the literature is just study after study after study. I mean, it makes my jaw drop to think that like this vitamin that, you really just wouldn't consider would just have so much to do with fertility, as it continues to be studied, has so much to do with fertility, to the point where I really believe, after this last study I read, I am going to make sure that my patients who are undergoing frozen embryo transfer, so we have a checklist. So your thyroid's good, your prolactin's good, your hepatitis is negative, your HIV is negative, this is negative. I'm actually, personally, I'm going to add vitamin D with normal levels greater than 40 to 50 onto my checklist, because the overwhelming amount of evidence that is coming out, and then not only for fertility, for pregnancy. So they have shown that patients with better vitamin D levels have less preeclampsia, less gestational diabetes, less preterm labor. Nobody really knows why. Is they're more attuned to their health? We really don't know why. However, this has been published widely for just pregnancy. So again, fertility is my passion, and then healthy pregnancy is my passion. So the vitamin D optimization can really play such an incredible role in improving your fertility success, your egg quality, your implantation rate if you're doing IVF, just getting pregnant in general. And then once it's optimized, you're going to have a healthier pregnancy. You're going to have less complications during your pregnancy, which is just kind of crazy that just a little vitamin can do that.
Yeah, I know. Inexpensive and readily available. Yeah.
Right, exactly. So, okay, this little question from our newly engaged patient. Does she need to have surgery to see if her tubes are clear? No, you don't need to have surgery. The Jupiter office has an HSG machine. We have a C-arm, and it's a super easy test to do in the office. Takes 5 minutes. You get results right away, and you can check your tubes. So that's super easy, and your physician in Jupiter can easily do that for you. And I would recommend it being done 2 to 3 months before you're ready to stop your Orlisa, and just make sure those tubes are okay. So yeah, super easy test, but you do not have to have surgery.
That's the HSG, or is there
hysterosalpingogram?
Was there a newer test out? Okay.
The hysterosalpingogram. I mean, it's not a perfect test. It's 80% accurate, but you don't have to have general anesthesia. I mean, it's super simple. It's easy to do in the office. Yeah, so super. And then we just got another question. Do you check liver enzymes, and how high enzymes can affect fertility? So I'm not the liver expert, okay? I'm not a GI expert. So I really don't have a lot of experience with liver enzymes and fertility. However, I do recommend, if I do see abnormalities in liver enzymes, that patient see a GI specialist. And I usually do not recommend trying to get pregnant if you have some sort of undiagnosed, elevated liver enzyme. We also will not prescribe in patients with polycystic ovaries, a medicine that commonly we prescribe for patients to improve ovulation, which is an insulin-lowering agent called metformin. And I usually, do not prescribe that drug with elevated liver enzymes. So again, in general, liver enzymes are not connected with fertility. However, that's connected with health in general, and we try to only get patients who are, healthy and pregnant. So, and again,
there's a question about the dosage of vitamin D.
Yeah, it comes in IUs, not milligrams, but it is very, very interesting. So in general, you should, supposedly 1,000 milligrams of vitamin D is supposed to raise your vitamin D 8 points. Okay, I haven't seen that's in general the rule, but I recently had a patient who vitamin D was 21. And I put her on 5,000 of vitamin D a day I use, and currently her level is now 31. So that did not correlate. So sometimes, and I've now recommended that we put her up to 10,000 units. Now, vitamin D is an interesting drug because you can actually overdose on it. Not that I've seen this, but you can actually, because it's a fat-soluble vitamin. Okay, so it is a vitamin that it doesn't get excreted from your body like some other vitamins, like vitamin C. You take you drink the entire bottle of vitamin C, you're going to pee it out the next day. Vitamin D doesn't work that way. Vitamin D actually will stay in your tissues. So one of the dosages that we have used for vitamin D that I've had really nice results with has been about 50,000 units weekly. So you only have to take this 50,000 of vitamin D once a week, and that has gotten my levels, my patients 40 to 50, where I've needed them to be. Essentially optimizing over 50 is supposed to be, the better level. But we've had some difficulty. I mean, when I first started, 10 years ago, prescribing vitamin D, we're like, oh, take 1,000. I mean, vitamin D level went from 17 to 18. That didn't do much. Then I up to 2,000, then I up to 5,000. 5,000 is 5,000 a day is which is 35,000 a week. has kind of been a good number for the majority of our patients. But some patients where we can't get it to where we want that level to be, the 50,000 weekly has been the answer. So it depends. It depends on, again, your body metabolism. But I have not really been able to make anybody vitamin D toxic, I have to say, over the last 10 years of prescribing it. I just have not gotten levels that, oh, no, stop taking that. That just hasn't been the norm. So,
and I think over 80, it becomes immunosuppressive. So you have to be careful.
Right. So over 80, so I just haven't seen that. I mean, I can barely get people to 40 to 50.
Yeah. I've seen it once, but it was also because someone was doing injections.
Oh, yeah, that would definitely have, interesting things for absorption. All right, so let's see what else we have here for questions. So what are the success rates of frozen eggs and embryos at your clinic? Okay, so that's an interesting question, because you have to talk apples to apples and oranges to oranges. So when we're talking frozen embryo transfer, we are talking tested embryos versus untested embryos. And so what I mean by testing is testing for chromosomal abnormalities, okay? So if we have tested the embryo and we find that it's what we call euploid, which has the normal number of chromosomes in it, then our positive pregnancy tests are running about 80%, and our live births are running around 64, 65%. So that's and all of our tested embryos are currently frozen. So when we're dealing with frozen embryo transfers in untested embryos, that depends on age. So if you're in your 20s, your chances that your frozen embryo not tested is healthy is 50%. So if you're in your early 30s, your chances your untested embryo is healthy is 40%. If you're 35 to 39, 40, your chances that your untested embryo is healthy is 30%. And subsequently, it goes on. And if you're 41, 42, it's 20%. If you're 43 plus, it's less than 10%. So, when you're talking success, we have to talk tested versus untested, because we even the playing field. We can put a tested embryo into a 25-year-old and put a tested embryo into a 45-year-old, and we're going to have really the same implantation rates and the same live birth rate. So, we're probably optimizing success in the majority of our patients currently because we are testing the majority of our embryos. But patients will come to us who have embryos frozen 5 years ago, 6 years ago, and they're untested. And so they definitely have a different success rate. The success rate will be based on the age the embryos were created. So hopefully that's helpful. And then I got so should I consume foods with vitamin D? Food consumption with vitamin D is excellent idea, okay? However, you really have to eat a significant amount of food in order to obtain optimal levels. So supplementation has really been the best way. I mean, mushrooms are a good source of vitamin D. Salmon's a good source of vitamin D.
And sunshine.
Sunshine. Well, sunshine activates the vitamin D. Okay?
Yes.
But then the problem is, hey, May is Skin Cancer Awareness Month. So I mean, that's the problem.
15 minutes a day.
I know. It's really hard to to prescribe sunshine when it's like the dermatologist will be after us, like, oh, we're promoting skin cancer. So the interesting thing as far as vitamin D is that, yes, we do try to encourage patients to consume foods with optimal vitamin D, but most patients will need to take a supplement in order to get their levels to kind of where we want them to be. And in general, what we talk about when we're talking about the supplementation with vitamin D is people care about your bones. Okay. So vitamin D and calcium keep your bones healthy. And so the levels we're looking for to keep your bones healthy is 20. Okay. So most people have that. I mean, I don't really see that many people with lower than 20. So, if you see your primary care doc, they check your vitamin D level is 22, you're good. Okay. But again, it's all about what your goals are. So if your goals are to have a baby, or you've been having miscarriages, or you've been having, issues with fertility, that's where the supplementation comes in. as far as that's concerned.
And
So
your thyroid too could be similar. Like your doctor could tell you your thyroid is perfectly fine, but if you're trying to get pregnant, it's
exactly.
not.
Same type of thing. So, I had an Instagram post several weeks ago that talked about, the foods for vitamin D: salmon, herring, sardines, cod liver oil, light canned tuna, egg yolk, mushrooms, fortified things, cow milk, soy milk, OJ, oatmeal. That's really, what you can eat. And then I have, optimized vitamin D levels. So if someone wants to check me out on Instagram, Dr. Ellen Wood, I do have my Tuesday tips. And I think this was a couple weeks ago. It's a daffodils at the page.
I love your TikTok videos too. They're so awesome.
I do have my vitamin D post, and this was done, a couple of weeks ago, trying to optimize those levels. But most of the time, it has to be done with supplementation.
And the Mediterranean diet's very rich in vitamin D too.
Yeah, well, all those good, fishes and things like that. Mm-hmm. So, yeah. So when you say 50, no, it's not 50. It's 50,000 IUs. Yeah. So that's the best one weekly. Okay. And then what particular supplement brand? Again, I really don't. I haven't investigated specific brands. We do have a specific brand we have in our office, and that Dr. Montenegro, recommends. But I'm not I don't have any particular allegiance to any particular supplement. I think if someone is taking a supplement that's, you bought at CVS, you bought at Walgreens, and your level isn't changing, probably you should change brands. But I am not the vitamin brand expert. Dr. Montenegro is a nutritionist in our office who has researched the different brands of all of the vitamin supplements that we recommend, and she has looked at them for quality, since the FDA does not, regulate this type of vitamin industry. And because of that, she has done lots of research into the companies that make these things, and she has tried to recommend to our patients that the vitamin companies that are testing their products properly and have the most efficacy. So we do have vitamin D supplements in our office, I believe. But again, our nutritionist, again, not myself particularly, has researched those. She they're the ones that she recommends. And again, trust me, she has gone above and beyond to make sure. I know we should have her. We should have her on the Instagram too, because again, we could just listen to her all night. I mean, she's just a wealth of nutritional knowledge. It just oozes from her pores. But yeah, I don't propose to say do what the best supplement is. I mean, all I can say is that if you're taking the over-the-counter one, and I check your level and it's not optimal, we need to change brands.
Yeah, I like pure encapsulations too, but I've seen the levels definitely change with that. They don't have any junk in them. They're pretty good. And they have what they say they have. That's the main thing, to make sure.
And then once pregnant, should I limit fish intake okay, again, check out my Instagram site. At Dr. Ellen Wood on Instagram. So I did do a post on fish consumption. And so fish intake is very healthy for pregnancy. However, there are certain fishes that you absolutely need to avoid. I think, yes, here we are. I've got my little post here. See me? I'm holding a little plate of fish there.
That's awesome.
Yeah, see? Yeah, and so we have on here. So we have, the fishes that you should eat, like in moderation, and then the ones that you should avoid. Okay, so I've got all this very, 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 very concisely kind of I just can't see it well, but kind of concisely put. And again, it's the little picture with me holding the plate of sushi.
It looks like you're holding a palette, like you're an artist.
No, my daughters did that. Like a little fish on my plate and everything. Sushi. So again, and the recommendations hold through pregnancy too. So again, that's why I did it, because we get these questions all the time. I mean, these are very common questions, and so I try to put the information to a quick little resource and say, hey, this is good, this is bad, like just bottom line type of thing. So I think if you check that out, I have it, all end out. One of the things that we get is tuna. And so, I was always told, when I go to albacore is the best tuna. Apparently, albacore has 3 times as much mercury as light tuna. Okay,
No.
so that's why we want to avoid albacore. Even though, again, as a kid, I was always, I go buy tuna for lunch, blah, 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 and get the albacore, that's the better one. Well, apparently it's supposed to be like maybe the tastier one or the better one, but as far as mercury consumption, it does have 3 times more mercury, and mercury is very, very, very dangerous in pregnancy, infertility. We just found a gentleman several months ago who was, routinely eating sushi, not realizing that this could possibly affect his sperm. And I've really never seen this before. And we checked this gentleman's mercury levels because I couldn't figure out what was wrong with his sperm, and he was toxic in mercury. My jaw dropped. I couldn't believe it.
In a blood mercury level? Or
in a blood mercury level. A blood mercury level, which should be apparently less than 10 or less than 12. His level was 33. So we have him down to 13 now. He's stopped doing that, and he's kind of getting the mercury out of his body without chelation, which is excellent. But it's just like that blew me away. That was definitely an eye opener that yes, this can actually happen. So mercury toxicity is something that is real. So if you had a healthy pregnancy and a baby, is it possible to have the same outcome for another? Sure. Absolutely. If I don't, know whether you did fertility treatment for your baby or not. Some people don't need fertility treatment after they have a healthy baby. And what I call that is we turned on the baby machine if we helped you, and then you didn't need us anymore. Yes, absolutely. It's possible to have the same outcome for another. Now, a lot depends on age. Okay. So, if you're older having your baby, we certainly recommend that you don't wait. But if you're in your 30s and you're having another baby a couple of years ago in your 30s, and if you're in your early 40s and you're trying to have a baby now at 44, 45, that is a completely different story. So a lot of having the next pregnancy depends on age. Okay. Oh my gosh, I'm so glad you feel better. I'm like, let's see. I know, like my TikToks. Oh, wait till Friday. I have a really fun one coming Friday.
I love the evening dress. Every
time I look at Fridays, it kind of makes me laugh too. I haven't posted it yet though, but I did it a couple days ago. Any tips on improving sperm motility and count? Yeah, well, again, same stuff we've been talking about for women. Same stuff we've been talking about, nutrition, blood flow, acupuncture, habits. Same thing applies to guys. Okay. So everything, but the interesting thing about gentlemen is that because they are not born with a finite number of sperm, okay, they can constantly produce them. We have an incredible opportunity to improve the sperm count just in 3 months. Just in 3 months. Sometimes it takes a little bit longer than that, but in women, we're born with a finite number of eggs. So we're not going to grow anymore. We just have to kind of make the ones we still have healthier. So, stuff like stop smoking, no vaping, no marijuana, cutting back on alcohol, decreasing heat exposure. I mean, heat exposure is sometimes something that gentlemen don't really realize can make a difference. I had a couple from the Keys, and they had their first baby, no problem. And we check out the gentleman, they're having problems having baby number 2. And we check out the sperm, and we're like, what the heck? Okay, apparently the gentleman, after, he bought a motorcycle and had been riding this motorcycle frequently. And it's the only thing that was different between easily having their baby and now having this semen analysis that wasn't the best. And we got him off his motorcycle, and within 3 months, we had that sperm peppy as ever. So, heat exposure, whether it's, long distance biking, long distance, motorcycle riding, any type of excessive heat to the testicles is going to be a problem. I've had couples who have bought a hot tub and didn't realize that they did it to decrease stress and relax in the hot tub at night. Okay. They didn't realize it was boiling the testicles and, and killing the husband's sperm count. They brought it, for stress. So, there's some things that people don't realize that can possibly affect, sperm counts. But improving motility is going to be, again, decreased heat exposures, improving nutrition, improving, getting rid of toxins that are estrogen leaching. plastics, microwaving in plastic, because so gentlemen's bodies, you know, shouldn't be exposed to estrogen because they're guys. But if you expose a gentleman to too much estrogen, whether it's via the environment or via extra body fat, that estrogen is going to lower his sperm counts. So maximizing, you know, trying to decrease body fat and things like that in guys. Same thing with women is going to improve fertility. So there's so many things a gentleman can do when he is, you know, when the semen analysis isn't perfect, to try and just improve things again naturally without doing fertility treatment that can help, because it is, you know, that 72 to 90 days to try to start to see a difference. And fertility vitamins for men are essential as well. So
it's amazing that they can just regenerate all this healthy sperm in just a few months. Like, if only we could work with eggs like that. But I mean, they have that chance.
Right. So again, so I had a question here. There's no perfect sperm count. So again, we have norms, and the norms are based on large numbers of data. Okay. So there are gentlemen who don't fit the norms that are still fertile, but the norms is we look at, you know, for essentially a sperm count greater than 39 million sperm. A concentration per cc of ejaculate is 15 million sperm per cc of ejaculate. So, you know, a guy says, should I fill the cup? I'm like, you don't really need to fill the cup. If you give us 1 cc of ejaculate that has 15 million sperm in it, we're good. For motility, we only need 40% of the sperm to be moving to be normal. Okay, so I mean, you don't always have 80% motility. I mean, it's great if you do, but 40% is kind of our minimum cutoff. And then, interestingly, as far as sperm morphology or the look of the sperm is concerned, we're looking for 4% of the sperm to have a normal head, neck, and tail. Okay, and we are very particular, our andrologists, when they are looking at the slide of the sperm to make sure the head's normal, the neck's normal, the tail's normal. And it's not like if a gentleman has a lot of abnormal sperm don't make funny looking babies. Abnormal sperm just can't fertilize eggs efficiently. So that's why the morphology matters. So, you know, they're the 3 parameters we look at, especially, you know, count and concentration, how many you have, which is the most important parameter. Motility, which is the second most important parameter, and then the look of the sperm. I get very nervous when I have a gentleman that has absolutely no sperm on the slide that looked normal. And that was my gentleman that I had who had the mercury toxicity. Recently had a gentleman who had, I believe that he was poisoning himself with plastics. And he's had 5 semen analysis done, 4 of which had 0% morphology, no number of sperm, or 0.5%. And we now have him, after we've eliminated plastics from his life for 3 months, we're up to 1%. I mean, this is a milestone. Yeah. I mean, we have some work in sperm now. So, I mean, hopefully she won't need my help now that we've got the sperm looking better. But there are definitely very subtle things a gentleman can be doing to mess up the way their sperm look and the way their sperm function. So, and I've got why my AMH went from 0.5 to 0.1 in 2 months. Well, that can be lab differences. AMH should not vary that much. And AMH is just a guide, okay, for a doctor to know how much medicine to prescribe. Okay, so AMH is not the be all end all, you know, you'll never have a baby, you'll have a baby type of number. AMH says, yeah, you're going to need a lot of drugs, you know, to get your ovaries to work. And so, you know, I try to make AMH, so an AMH of 0.5 and AMH of 0.1, it concerns me, but I am not going to, you know, tell you you have a bad prognosis because of that. Because if I have someone who is 33 with an AMH of 0.1, I've gotten them pregnant. I mean, so we use it. It's not a tool to say you will or you won't have a baby. It's just a tool to say you're going to need a little bit more drug than I thought you were going to, or, you know, instead of just prescribing you, you know, our medium dose, you know, we're going to give you the high dose. And it's just, it prevents cycle cancellations, and it's going to optimize the chances that we're going to get, you know, that those 3 to 5 eggs that we want to see. because quality over quantity. I mean, you don't need 50 eggs to have a baby. You just need one healthy one.
One good one.
One good one. And you have that one good one, you have the baby. So I don't, I really, really, really stress that my patients don't get stressed over AMH levels. I mean, again, because I treat patients, not hormone levels. Okay. And again, that's the way I've practiced. And if you don't do it that way, you're not going to be, you're not going to be surprised. You're not going to have successes with people with lower AMH levels because you shied away. You didn't treat them. You're like, oh, no, you're not going to do well. You need a donor egg and you're only 35. That's ridiculous. So now if we treat you and we don't see the quality, we try to optimize things. But again, it's just a test on paper. It's just a test on paper, and there's many different interpretations of it. But for me, I use it to say how much drug I'm going to prescribe you just at the get-go. And so the place of testing can affect the result. Unilab is kind of our benchmark. I mean, they're the lab that we really prefer to get the AMH. They have done the assay the longest. I mean, they've done that assay for the AMH like from the get-go. We started doing it, I think it was maybe 12 years ago. We realized this is going to be like a hormone that's going to help us treat people. They have had the most advanced assay with the most consistent results, year after year after year. Quest and LabCorp kind of, I don't know how their assay compares, but I've had patients who have done a test at Unilab and a test at Quest, and they haven't been that off. I mean, it's not like I get huge variations, but I do believe that when we're trying to pinpoint a patient where you are as far as your age, because that's what matters. It's just, a reflection, say, okay, a 35-year-old patient, your level should be between here and here. And Unilab has done 10,000 35-year-olds or, so many over the years, and say, this is where the average patient falls. We can say, you are average for your age, you are below average for your age, which concerns us that you shouldn't wait to have your babies. Or you're above average for your age, and we're not going to need much medicine to get you stimulated. So, but Unilab has been our go-to lab, and again, they just they've done the assay the longest. But I get patients, I do patients at Quest and LabCorp, and if I'm really concerned about it, I will send the blood to Unilab if the insurance didn't cover it or something like that. But in general, the thing that really matters is how you respond to fertility medicine. I mean, that's really the bottom line.
I'm curious because she has a Let's Get Checked home test. I haven't heard of that. Has that been?
Yeah, I haven't heard of that one either. But it would be cool to to see how they correlate. I think I actually had one patient who actually did that. Who did say she bought, yes, I did have one, but she spent $100 or whatever and bought an AMH test off of the internet, and did it somehow herself. And I do believe it did have decent correlation with what we actually did in the office. So, and I've seen, there's no at-home sperm tests, and again, if you're that motivated, to do that, I think the tests, do have some validity. However, the way you have to use the test, okay? If you get a, Let's Get Checked home test and it says your AMH level is lower than it should be, you need to see me. Like you don't need to keep doing stuff at home. Like you need to come to our office. We need to get you pregnant yesterday. I mean, so I think, especially, even the semen analysis that you buy for $70 at Walgreens, if it says that your husband's sperm don't look good at the Walgreens semen analysis, you need to see it. I mean,
maybe it's a good encouragement too for the partner who might not feel like coming in to get the everything checked.
They do have the more and more at-home stuff, which is again, I haven't had a lot of patients do it, but the ones who have done it, my personal experience has been it has correlated with what we found in the office. So is poor egg quality the biggest concern? PCOS patients are so different as well as difficult, because poor egg quality can come from too many eggs. So there are so many things that we can do with a PCOS patient to optimize their quality before we take them through a treatment. So quality optimization has been, something where the acupuncture helps. Supplements, myo-inositol, metformin. There's so many different supplements that can really change for the better egg quality in a PCOS patient. I have been amazed at the difference that these can make. I mean, in general, we used to think of PCOS patients, oh, they don't ovulate, we get them to ovulate and get them pregnant. Not the case in everybody. We can get, I had one case 15 years ago, PCOS patient, we got 55 eggs from her, didn't even get an embryo transfer. Everything died in the dishes. That's some bad egg quality. I mean, you think 55 eggs, you should have 10 babies. Nope, they were that bad. So we do all, everyone, every physician in our practice really focuses in on, we need to get the PCOS patient to ovulate, but, that's fundamental, but we also want to optimize her nutrition before we do that.
That's definitely. And also the vitamin D, we've seen a correlation. I don't know if you've noticed.
Oh, yeah, but PCOS also. Mm-hmm.
Yeah.
And vitamin D is everywhere.
It's got something to do with it.
Yeah. It really is. So here's an interesting one. I don't know about IVF. I didn't know about IVF before I went to St. Louis to do my IVF process. And my 2 transfers worked. It was crushed. I had a lot of I had 2 cycles. I'm not giving up. Again, as long as the fundamentals are in place, so you're under the age of 43, okay? We don't have any significant underlying medical conditions. Your BMI is, less than 35. There is absolutely no reason to give up after 2 failed cycles, because some clinics, and again, lots of clinics do look at the whole patient, but some clinics don't. Some clinics are just like, especially in St. Louis. So St. Louis is in Illinois, right? Yeah, and there's IVF coverage in Illinois. So a lot of states, interestingly, that have IVF coverage, they think about IVF a little bit differently than we do in our state, where many of our patients, they make enormous financial sacrifices, okay, to do treatment, okay? And we try, and again, I'm going to quote Scott again, like last week I did. This is a Scott. He's like, do it right, do it once. I mean, he wants you to pregnant his first try. And that's one of the things that we really try to optimize, especially in our state, because, patients don't have insurance coverage. So, if you're in a state that does insurance coverage, okay, we're looking at your cycle as a number. Let's just rack up the cycles. You're in New Jersey, you get 4 cycles coverage. You're in, Massachusetts, you get 4 cycles coverage. You're in Maryland, you get 4 cycles coverage. You're in Chicago, Illinois, you get 4 cycles coverage. So let's just bang out those cycles, and we're going to get lucky in one of them.
It's in Missouri, right?
So yeah, there's 15 states that have an IVF coverage. But again, when you practice in those states, or at least I have not, but the thought in those states is, let's just crank out the cycles. Let's just crank out the cycles. When you're in Florida, and again, we're used to patients, again, making huge sacrifices to do the treatment. All right, well, let's do everything we can possibly think about and think of to make this work the first time. It doesn't always work the first time, but let's do everything that we can think of. And then if it didn't work the first time, what else could we do? What else could we do when we try it again? So I do think sometimes that you do have to think this way. So when we have a patient who has failed a cycle somewhere, we always want to review the records. We do free second opinions, and we want to see, all right, well, could we change this, or could we change that? Could we optimize this? Did we miss that? Did we miss that? So we do have, a pretty routine type of algorithm for patients who may have, not been successful elsewhere. And we do see a lot of second opinions, and we say, oh, well, we didn't check this. And then we check it, and we're like, that was the problem. And then we repeat a cycle, and they're successful with us. So, with our second opinions, I know we did a study with all the doctors, a couple years ago, and say, how many patients were successful after they'd failed elsewhere, and the number was insane. It was like over 70% or something crazy like that.
I believe that for sure. But like if you're in South Florida, you don't need to travel, because you got you guys. It's right there, So.
Right. But again, you have to think about it that way. It's like, all right, what else could we do? Like, do we miss anything? Because there's so many different subtleties, and again, that we want to optimize and maximize. And again, all of our docs are really treat patients like that. So if a young lady, for 2 frozen embryo transfers after 2 losses from IVF, am I able to get them tested now? Actually, yes. We've had amazing success with thawing embryos that were frozen, testing them, and then refreezing them and replacing them into patients. It does depend on the quality of the embryo when it's frozen. Our embryologists, if they're not done in our clinic, will have to review all the records and see whether or not those embryos are optimal for thaw and biopsy, because some embryos are and some embryos aren't, depending on the clinic that the patient went to. But we have really excellent success. I've got lots and lots of babies over the last 5 or 6 years from embryos that, were not tested initially, because again, it wasn't the thing 5 or 6 years ago to test. And we've thawed them, tested them, refroze them, found out which ones are normal, and then replaced them. So I started my process age 38, not to my transfer 39, March 39, another August. Again, still 38, 39. Okay, we're good. Like we make lots of babies at those ages. So 38, 39. That's once we start hitting 43, that's when things get a little sketchy as far as can we help you or not. But 38, 39. Those embryos were made at 38. We have to make sure that everything was tested before you had that failure to make sure there's no other confounding factors. So let's see.
Did we get through our questions that were submitted?
I think a couple more here. I think we got most of the acupuncture ones. Let me see. Let me see what else we got, because we're running out of time again. Okay. Ideal amount of sessions, polycystic ovaries. Can I get pregnant taking birth control pills? Well, that's what birth control pills are for, not to get pregnant. So if you skip your pills or you miss a pill by more than 12 hours, yes, you could get pregnant taking birth control pills. Because we see a lot of patients who are taking birth control pills. We give them to prep them for in vitro, and they have cysts, and those cysts are actually escape ovulations. So they could get pregnant if they have those cysts. So birth control, you have to take it very, very, very properly in order for it to be successful.
We have a question on Facebook, actually.
Oh, okay.
So.
Yeah, that's a big long one. Okay.
Jordan, thanks for posting on our Facebook. You're our first question on Facebook.
Yeah.
So let's see. Would you like to read it or?
Yeah, let's see. So food for thought. Don't know if other of you ladies would know, but I want to ask the question that I had and wanted to know if there was any evidence the two are related. Is there a correlation between babies being born from mothers with gestational diabetes and the baby having a higher chance of PCOS? There is some interesting evidence about different disease processes that are from moms with gestational diabetes. I haven't really read one about PCOS, but they have a higher chance of developing type 2 diabetes, exactly like you said. And I wanted to know if I same for PCOS as well. My mother told me she had gestational diabetes when she was pregnant. I was diagnosed with PCOS, insulin resistance. Again, PCOS is a genetic problem. I mean, so PCOS, again, this is some sort of genetic predisposition towards this. And so PCOS patients in general have a higher incidence of gestational diabetes. So your mother, again, might have had also PCOS, and therefore you have that genetic predisposition towards PCOS, which caused her gestational diabetes, and then you inherited, part of that PCOS type gene. So, yes, there can be absolutely be a correlation with those things, because those things run in families. I mean, I have sisters, mothers, and it just, the mother had her babies early, she was hadn't gained weight after pregnancy for that type of thing. So there's a whole bunch of things that are involved with PCOS, but yes, there's definitely a genetic component to it. So the two things could be related for our Facebook question there.
And definitely it's great to address this now, because if you're planning on becoming pregnant, you can actually help the future generations, right? By getting your nutrition right and everything. So.
Yeah, it's amazing how much, just whole body health can play in everything. Your pregnancy, and then your pregnancy carries over into your baby. I mean, that's why we optimize thyroid. So optimal thyroid hormone in pregnancy leads to better cognitive development in the baby. It's like, how did they figure those two things out? But the evidence is huge as far as that's concerned. So anyway, we're starting to run out of time. So I just want to thank everybody for the questions they submitted. Hopefully we got to most of them. I tried. to get to those. And then I'd like to thank Dr. Duro for, doing this joint thing, which we got the tech good tonight.
Got it down.
Yeah, so I think that's been great. And thank everyone for their questions. Hopefully, we got the answers. And hopefully if you need our help, our information is on our website, IVFMD. We've got 12 physicians and 6 locations in order there to help you. And Dr. Duro, she said her office is in Southwest Ranches. And hopefully, if you need her help, she's there for you too. All right.
Complete wellness. And next Tuesday, we're having a Facebook.
Oh, wait, exactly.
Yeah.
So
donor and surrogacy issues. So that would be a fun one with Dr. Gelman as well. So
yes, excellent.
Thank you guys.
Again, great talking to everybody.
Bye, everyone. We look forward to talking to you next week. Have a good one.
The stress again. Okay.